In this video we will talk about brain hemorrhage, that how it happens to us. A brain hemorrhage, or intracranial hemorrhage, occurs when blood vessels in the brain rupture, causing bleeding within or around the brain tissue. This condition disrupts normal brain function and can lead to severe complications or death if not treated promptly. Understanding the causes, symptoms, and preventive measures is crucial to managing this serious condition. Types of brain hemorrhage. Brain hemorrhages are categorized based on their location. These include intracerebral hemorrhage, subarachnoid hemorrhage, subdural hematoma, and epidural hematoma. Each type has unique characteristics and underlying causes but shares a common result: increased pressure on the brain tissue. Here we have few major types of brain hemorrhage. 1. The role of high blood pressure. Hypertension, or high blood pressure, is one of the leading causes of brain hemorrhage. Prolonged elevated pressure weakens the walls of blood vessels in the brain, making them more susceptible to rupture. Uncontrolled hypertension significantly increases the risk of this life-threatening event. 2. Aneurysms and their impact. An aneurysm is a weakened or bulging area in a blood vessel that can burst and lead to a brain hemorrhage. While aneurysms can remain silent for years, certain triggers like physical exertion or stress may cause them to rupture suddenly, resulting in catastrophic bleeding. 3. Trauma and head injuries. Head trauma is another primary cause of brain hemorrhage, especially in younger individuals. Accidents, falls, or sports-related injuries can damage blood vessels, leading to internal bleeding. In many cases, the severity of the hemorrhage depends on the force and location of the trauma. 4. Blood vessel disorders. Conditions like arteriovenous malformations, AVMs, where arteries and veins are abnormally connected, can increase the risk of hemorrhage. These congenital abnormalities can lead to weak blood vessels that are prone to rupturing, even without significant triggers. 5. Blood clotting disorders. People with blood clotting disorders, such as hemophilia, or those on anticoagulant medications, have a heightened risk of brain hemorrhage. Impaired clotting mechanisms mean that even minor blood vessel damage can result in prolonged and dangerous bleeding. 6. Lifestyle and risk factors. Lifestyle choices significantly impact the likelihood of a brain hemorrhage. Smoking, excessive alcohol consumption, and drug use can weaken blood vessels and contribute to conditions like high blood pressure or aneurysms, increasing the risk of rupture. 7. Brain tumors and hemorrhage. Certain brain tumors can press against blood vessels, leading to their rupture. As tumors grow, they may compromise the structural integrity of nearby vessels, causing bleeding. Tumor-related hemorrhages are particularly dangerous due to their complex nature. 8. Infections and inflammation. Severe infections, such as meningitis or encephalitis, can lead to inflammation of blood vessels in the brain. This inflammation weakens the vessels, making them more likely to rupture. Timely treatment of infections is essential to prevent such complications. 9. Age-related factors. The risk of brain hemorrhage increases with age due to natural wear and tear on blood vessels. Older adults are also more likely to have underlying conditions like hypertension or blood vessel abnormalities, which further elevate the risk. 10. Genetic predisposition. A family history of aneurysms, AVMs, or clotting disorders may predispose individuals to brain hemorrhage. Genetic factors often influence the structural integrity of blood vessels and their susceptibility to rupture. Here are some more things we should keep in mind too. The role of stress and emotional triggers. Acute emotional stress can cause a sudden spike in blood pressure, which may trigger a brain hemorrhage, especially in individuals with pre-existing conditions. Managing stress through relaxation techniques and a healthy lifestyle is vital for reducing this risk. Medication and drug-induced hemorrhage. Certain medications, such as anticoagulants, blood thinners, and some over-the-counter drugs, can increase the risk of bleeding. Illicit drug use, particularly stimulants like cocaine, is also a known trigger for brain hemorrhage due to its impact on blood pressure and vessel integrity. The danger of silent symptoms. In many cases, the symptoms of a brain hemorrhage can be subtle initially, leading to delays in seeking medical attention. Symptoms like sudden headaches, dizziness, or vision changes should not be ignored, as timely intervention can be life-saving. Diagnosing brain hemorrhage. Brain hemorrhages are diagnosed through imaging techniques such as CT scans or MRIs. These methods help pinpoint the location and extent of the bleeding, enabling healthcare professionals to determine the most appropriate treatment plan. Treatment and management. Treatment for brain hemorrhage varies depending on the cause and severity. Options include medications to control blood pressure and swelling, surgical interventions to repair damaged vessels or remove clots, and rehabilitation therapies to aid recovery. Preventive measures. Preventing brain hemorrhages involves managing risk factors such as blood pressure, avoiding head trauma, and addressing lifestyle habits. Regular health checkups and early detection of conditions like aneurysms or clotting disorders can significantly reduce the risk. Long-term effects and recovery. Recovery from a brain hemorrhage depends on factors like the size and location of the bleed, the patient's age, and the timeliness of treatment. Long-term effects may include physical, cognitive, or emotional challenges, emphasizing the importance of rehabilitation and support. What we learned from the video. Brain hemorrhages are a serious medical condition with various causes, from hypertension and trauma to genetic factors. Understanding these causes and taking preventive steps can reduce the risk and improve outcomes for those affected. Early intervention and proper management are critical in ensuring the best possible recovery. Thanks you for watching Med Talks Daily Channel.